go. Thank you, everyone, for joining us today. Dr. Handley and I are really honored and thrilled to be here, and we're going to do a quick introduction. So, Dr. Handley.
Sure. So I'm Dan Handley. I'm the program director for the Master of Science in Human Genetics and Genomics at Southern California University of Health Sciences. Previously, I was the chief scientific officer of the Clinical and Translational Genome Research Institute. I've worked at UCLA and Procter & Gamble and some startup companies. So I have a broad background in genomics and biotechnology. Right now, I'm a full-time employee of SCU, and I'm also on the board of directors of a publicly traded company named Predictive Oncology. So that's a disclosure, but it's also demonstrates that I keep a foot in the academic world and also the biotech world. I have a PhD in human genetics from the University of Pittsburgh. I have a Master of Science in Logic and Computation from Carnegie Mellon University, and my bachelor's degree is in biophysics from Johns Hopkins.
And I'm Stephanie Gandomi. I'm the program director for the new Master of Science in Genetic Counseling program at Southern California University of Health Sciences. And we are just taking our first cohort coming here soon in the fall of 2025. I'm a board certified licensed genetic counselor. I have been in the field for over 20 years, and I have a background in clinical genetics, clinical genetic counseling, and I also worked in biotech laboratory with an emphasis on rare disease, pediatrics, whole exome, and genome sequencing. And then spent some time as the director of genetics at United Healthcare and Blue Shield of California. So I have a background in coding, billing, reimbursement, and medical policy for genomic testing. So I also have no conflicts of interest to disclose, but I'm a full-time employee of SCU. And our learning objectives for today are that we're going to explore how precision medicine utilizes genetics, environment, and lifestyle factors to tailor diagnosis and treatment for individualized patients. We're going to assess how whole health can be incorporated into the clinical genetic setting for improved patient outcomes. And we'll also identify practical ways in which whole health approaches can be implemented in genomics for enhancing patient care. So Dr. Handley is going to start us out, and then I will finish on the tail end. So I'll hand it over to you.
Sure. Thank you, Stephanie. So when I imagine when many people think about genomics, they think it's high tech and it's very new. However, it's actually ancient, at least genetics is. So if you look at any modality of healthcare, essentially, health history plays a role, right? So we've known for millennia that children tend to resemble their parents, and also there tend to be diseases that run in families. So inherent in pretty much every culture in how health has been practiced, health history has always played some role in that, and it's been very helpful. So even before we understood what human genetics really was, inherently we were using human genetics as part of clinical practice. Now we have more modern understanding, and we also have more technology to bring to bear to improve using genetics and genomics to help every type of healthcare. So genetics is inherently a part of whole health. So next slide, please. Well, and so here with a deeper understanding, so we can bring modern human genomics to augment and support whole person human health. So there's a number of ways we can do this. And not only can genomics provide empirical evidence for the efficacy of ancient healthcare practice, it can also provide actionable information for preventative health, which is important for whole person health as well. So being able to do not only a family history, but in certain cases, if there's certain diseases that tend to run in families, predominantly a hereditary cancer syndrome, that would be potentially very, very useful in healthcare to see if a person has a hereditary cancer syndrome that would predispose them to a much higher risk of cancer. So we do know the most prominent one is hereditary breast and ovarian cancer. And the two genes that are remarkable involved in that are BRCA1 and BRCA2, which everyone hears about in the media. There's a number of genes that are involved in these hereditary cancer syndromes. The idea is that this is a proactive approach to healthcare by knowing this in advance. Knowing if someone has one of these hereditary cancer syndromes, which could really increase their risks of different types of cancer. So the next slide, please. So what is whole health? So I've taken this from the SCU's website. It's not it's about comprehensive well-being and not merely the absence of illness. It requires healthcare professionals to consider not just physical, which is very traditional in Western medicine, but also the mental, spiritual, socioeconomic, relational, environmental, and systems level factors that may be impacting a person's health and well-being. So for us, all of us, I think in the audience and the presenters, this is sort of a no-brainer, right? That if you want to treat, the patient, you really want to prevent disease. You want to look at all aspects of a person's life and what's contributing to their well-being and how they can live their life to the fullest, as opposed to what many of us experience with traditional Western medicine is you go to a doctor, what are your symptoms, do a diagnostic test, and you walk out with a prescription, you go to a pharmacy, right? Without any follow-up, no discussion about any of these other types of issues. So next slide, please. So genomics can help the healthcare providers develop tailored treatment plans based upon a person's genetic profile. So, which is hereditary, right? So they're synonymous. And so these can allow for more effective and targeted therapies. So using genomics is an integral part of treating the whole person, because now you're looking at what types of what they've inherited in terms of their genetic predisposition and others. So next slide, please. So of course, the first thing is we could do a disease risk assessment, as I mentioned. So we can look at if someone does have some sort of health history, and we can see it's not just cancer, but many, many diseases, cardiac conditions. There's certainly a risk for Alzheimer's disease, many, many conditions that could be that could be found using genetic tests. So this helps support healthcare regardless of the modality. Next slide, please. So here's an example. And why we're not using pharmacogenomics routinely is a mystery, because it's it has a lot of benefits and really no downsides. So pharmacogenomics, it's a long name. It's pharmacology plus genomics. So just as genetics plays a role in our hair and eye color and how we look, it also plays a role in our personal physiologies, including how we respond to drugs, any sort of medications, and by using genetic tests that are specific to genes that are responsible for producing the proteins that are involved with metabolizing drugs and drug targets, then we can more precisely prescribe medications, the right medication at the right dose to reduce adverse effects and to improve the efficacy of the drug, and also more safer drug dispensing. So this is really, again, in the spirit of integrative health and whole health, in terms of we're looking at all different types of information to help us decide whether how to tailor a treatment to the actual person, as opposed to the old paradigm of medicine is you look at population averages. In fact, that's the way things are done now. That's why you have biostatisticians, right? That you're looking at populations and you're comparing the central tendencies, means from one group, the control group, to the experimental group. Well, that's not treating each person as an individual, that's treating people in aggregate. So it's a whole different mindset when you use pharmacogenomics or genomics in general, that you're looking at individuals as individuals with individual genetic makeups. So it's perfect harmony with whole person health. Next slide, please. Another example. So I know that a lot of us, me included, we think that medications are often overused, and they're used in ways that just treat the symptoms and not really the underlying conditions. And so I'm in perfect agreement with that. So, but there are cases where medications are just not, not avoidable. Another example of how we can use genomics is nutrigenomics. So again, we all process foods differently, and it's because we have different metabolisms and different, different ways of metabolizing, absorbing and metabolizing foods and nutrients. And a lot of this, again, is based upon our personal genetics. Next slide, please. Also, something that may not initially come to mind is environmental interactions. So whether we like it or not, we're all exposed to environmental toxic materials, right? And so how our individual bodies respond to that, again, has a genetic component to it. So understanding how a person's genetic makeup influences how they metabolize and their body disposes of toxic substances. It's a discipline called toxicogenomics. And so, in the future, I believe this is going to be much more important and being part of a whole workup. So we can have genomics-based tests that look at disease predisposition. We can look at pharmacogenomics. We can look at nutrigenomics, and also how our genetics for an individual person can affect how they might respond, their bodies might respond to certain toxic substances. Next slide, please. And of course, there's not just genetics, but epigenetics. So epigenetics refers to anything that 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 alters gene expression, but doesn't alter the actual genetic code. So these are very important changes. So they're semi-permanent, and they have to do a lot with lifestyle. And they can be inherited from generation to generation, at least from grandparent to grandchild. We don't know how much beyond that some of these epigenetics can be inherited, but they do have a profound effect on health. And so, what if your grandparents smoked or drank alcohol, were malnourished, or even endured severe psychological trauma? All of those things can produce epigenetic modifications that can be inherited to parents and to the grandchildren, right? So this is really important, and this helps us. Learning about epigenetics can help us learn how we can use lifestyle changes to help mitigate or reverse some of these adverse effects. Next slide, please. So, so in summary, we've been practicing human genetics and genomics for millennia. It's always been a part of healthcare. It's always been a part of every modality of healthcare, regardless of the culture, in some form. And it's just a natural part of how we can incorporate all of these different elements of what makes each individual an individual, right? So from our individual genetic makeup to our emotional well-being, our environments, our spiritual aspirations and beliefs, and all of the things that make us a unique human being, genetics is right in the center of that. And so there's a lot of potential to help improve healthcare for everybody using all of these tools and all of these approaches simultaneously. So with that, I will turn this over to Stephanie Gandomi.
Thank you very much. So yeah, so everything, that Dr. Handley was saying is really what we're starting to see emerge in the field of genomics, and especially even in clinical genomics. So when we think about working with patients directly, if we think about how do we actually bring this information and these advances to the clinical setting, one of the great ways to do that is through genetic counseling. And so what we do here at SCU in our genetic counseling program is we really study how the genetic counselor can use these integrative approaches in genomics to be part of an interdisciplinary care team. So working with both physicians, nurses, medical staff, but then also looking at ways in which we can work with integrative health practitioners as well. So genetic counseling, some of you on this call may know what a genetic counselor is and some may not. So we're going to level set here for a second. Genetic counselor or counselors or genetic counseling is the process of helping people understand and adapt to medical, psychological, and familial implications of genetic contributions to disease. And so that really just embodies everything that Dr. Handley was talking about. We often, as a genetic counselor in clinic, would see patients for pregnancy planning. We may be helping to diagnose childhood onset disorders, conditions. We may be working with adults who are either suffering from a rare disease or may have an adult onset condition like a neuromuscular condition. We often work with rare diseases, pharmacogenomics, oncology, and then we also look at preventive medicine, ways in which we can use genomics as prevention for onset of disease, either for personal or family histories that present in clinic. And just a little quick plug, we are really proud to demonstrate how we're bringing this in actual tangible ways to the medical community. One is obviously our training program. So we'll be training the next generation of integrative health genetic counselors. And we just received accreditation. So we're really excited to be launching this program. But even, potentially even more exciting is the fact that we're putting this into practice. So we started an integrative health genetic counseling service at the SCU Health Center, and we have a genetic counselor who is also trained in integrative and functional medicine, and she's going to be providing these services to patients. So if you have patients or yourself or other family members who are interested in receiving integrative health genetic counseling, we actually have a clinic available through SCU. So genetic counselors, we have advanced training in medical genetics, molecular genetics, so understanding the underlying genetic etiologies of disease, but we're also trained in counseling and ethics. We have backgrounds in research, advocacy, and we're really now moving more and more into figuring out how that genetic counselor fits into the broader healthcare system. How do we form interdisciplinary collaborations with both peers and other colleagues within the healthcare system, but also this extends to our colleagues in the integrative healthcare space as well. And so when we think about integrative medicine, it's really some major points come to mind, right? We think mind, body, spirit. We think of whole person healthcare, ways to optimize health, to prevent illness, to treat disease by considering all factors: environmental, psychosocial, the spirit, the feeling, the emotion that the patients are going through, or even before disease onset, what's going on in their environment. We're looking at the root cause. Dr. Handley was speaking about even toxicogenomics. Is there something in your water? Is there something in your soil that might be that, or is it truly coming 100% from a gene that has a mutation? And then of course, genetic counselors also are really interested in family dynamics, but so are integrative health professionals. So there's a lot of overlap there. And then integrative health and integrative medicine is most interested in that holistic perspective, not just the disease, but everything about that person. And really, if you kind of compare all of those points to what a genetic counselor does, they're very similar, right? We're trained and have been for decades on emotional support and personal and family history risk. We can't take the emotions away from receiving a diagnosis of hereditary cancer. And then if you have that hereditary cancer diagnosis, what does that look like for your family members? And who else is at risk? So we're constantly looking at risk assessments, not just for the patient, but for the patient's entire expanded family system as well. And as Dr. Handley was mentioning, the more we obtain advanced technologies in diagnosing patients in genomic medicine, we're able to use that information now more than ever before to prevent the onset of disease. So that also gives us the ability as genetic counselors to really engage in shared decision-making with patients, and to look at the underlying etiologies, both of symptoms, but also of predictive disease onset. So if we know which gene has a problem, not only do we know what symptoms it may be responsible for, but what symptoms may be coming in the near future that the patient can either proactively try to prevent, or at least be prepared for and potentially manage with either medication or alternative therapeutics. Family systems, generational medicine, even as Dr. Handley was saying, what's happened 3, 4, 5 generations ago, even if it's not documented, sometimes it lives in oral history, and that can be really important for managing not only the person in front of us and the genetic disease or the genetic diagnosis, but then also how we are going to help that patient with managing the next generations to come. Environmental triggers, again, that toxicogenomic component, is a huge area of interest, and especially as it invokes epigenetics. So what we're seeing in reality as genetic counselors is that there has been a massive shift in the way that we work in genetic medicine, and we use genetic medicine for managing patient care. So the kind of traditional model, if you will, was that we would have a patient come to genetic counseling or genetic services because there was a risk. They either had a family history or a personal history, let's say, of cancer. And then immediately the genetic specialist would do genetic testing. So we would order the test, we'd receive the results back. If there was a diagnosis that was clear, we could then proceed forward and help the patient with doing treatments like preventive mastectomy or oophorectomies. Now it's different. Now we're starting to move into a much more holistic approach, which includes even healthy patients or healthy people coming to genomics and saying, either I'm adopted and I don't know what my family history is, or I don't have any concerns, but I want to be proactive. And so, with the use of advanced technology like whole genome sequencing, which is getting less and less expensive by the day, that whole genome sequencing could actually be used on a healthy person. And we could use that information to monitor and prevent disease onset. And so then if there is nothing concerning, that's great, right? What a great way to kind of start out as a young person saying, hey, I have a pretty clear whole genome. There often is something, either carrier status or some information that comes from these tests, right? So you have to also make sure you have trained individuals working and informed consent involved in this process. But if there is something concerning, then you can bring that to the healthy person's attention and say, we discovered you're at risk for this condition. And they can receive the proactive diagnosis, and then treatments can proceed forward in a preventive way. And this may all kind of sound science fiction-y, but it's not. It's actually happening right in front of our eyes at the moment. And so one really interesting study, if you're unfamiliar with it, I would suggest definitely taking some time to kind of go to this website and check it out. It's called the Guardian Study. So it stands for Genomic Uniform Screening Against Rare Disease in All Newborns. And it is being conducted in New York. There is a gene list on the website that shows you the 450 diseases that are being screened in newborns in the study by the use of whole genome sequencing as a preventive measure for catching diseases early on, right at birth. And so this is a pretty interesting study that we're watching closely, because if the results of the study really show that interventions and disease onset can be prevented, then there's a great chance that this will be extrapolated to newborn screening programs nationwide. But of course, we're not just going for every disease. We have to be responsible in the way we use genomics, and especially in healthy individuals and newborns. There's a huge ethical dilemma that we're faced with, which is where genetic counselors can be highly impactful, because they're trained in ethics and advocacy. So we have to hold space for both the patient and their needs and their psychosocial and emotional needs and the family dynamics that can come from having a genetic diagnosis, but then also looking at the risks and how they potentially outweigh the benefits, or vice versa. And the benefits obviously can be disease prevention. So there has been for a while, the American College of Medical Genetics and Genomics, the ACMG, has produced a list of actionable genes. So we don't just kind of throw a genome at everyone and just test every single gene and then give them every single gene, piece of information about every gene in the genome. That wouldn't necessarily be responsible. So what ACMG has done is they've produced a list of actionable genes. I think currently the most up-to-date gene list is 81 genes. And these are genes that have true actionability, true significance to health risk, or can be associated with death or life-threatening disorders. They have a high penetrance, which means that if you have a mutation in that gene, it is extremely likely, very highly likely, that you will have that disease onset. and then early detection benefit, right? So there has to be some benefit in finding out this information early on for either prevention or availability of treatment. So there is a pretty, intentional gene selection criteria for these actionable genes. And usually, if you look at the list, and they've evolved, there used to be ACMG 54, and then it went to 60, and now it's 81. This gene list generally includes genes that are related to hereditary breast and ovarian cancer syndrome, Lynch and colorectal cancer syndrome, familial hypercholesterolemia, malignant hyperthermia, familial hypertrophic cardiomyopathy, hereditary hemochromatosis, connective tissues disorders, and neurological conditions. And as you can see, if you kind of compare that list of the genes in the ACMG gene list, right, it really can put the genetic counselor at the center of a genomic interdisciplinary care team, which is what we're really teaching and speaking with our students about, is trying to see how the genetic counselor can obtain some of that information, manage it in a way that's ethically responsible, obtain that informed consent, get that genomic diagnosis, and then help that patient go into the next step with the oncologist or the cardiologist, neurologist, integrative medicine specialist, or any other specialist that's relevant to that condition, and really help kind of be part or be sort of central at that interdisciplinary infrastructure that helps the patient get optimal care. So we love to really see this new model rather than genomics kind of functioning, in a silo. It really is critical that we become more and more integrated into this interdisciplinary management system. So to kind of wrap it up, I'm hoping that after this talk, most of you are sitting there saying, how do we start working with genetic counselors more? And how can we actually bring this into our clinic? And that would hopefully be our goal for this talk. So one great way, besides contacting us if you have questions or would like some help with that, is to go to the National Society of Genetic Counselors website, which is where essentially I think we're up to 4,000 or 5,000 genetic counselors nationwide, pretty much is our central hub. You can learn more about genetic counseling, training. There are education events, annual conferences to attend. You can take a look at our standards of care policies, code of ethics, things like that, research and publications. But then you can also, if you see on the screenshot on the corner, you'll see a little flag if you go to the homepage and it says find a genetic counselor. So there are often genetic counselors in your area. And of course, not every genetic counselor to date has been trained in the modalities of whole person health or integrative health, or may not even necessarily be familiar with functional medicine. But at minimum, you can find a genetic counselor in your area to have a conversation with, or to start a relationship with, and say, I'm seeing patients with chronic pain, or I'm seeing patients with cancer in my practice. How could we work together to make sure that they're getting the genetic testing they need in a responsible and ethical way? And then working in partnership so we can then help manage the treatment and the quality of life and the quality of care together in a kind of a patient-centric way. So that is my plug for NSGC. And I guess at this point, we'll take questions. See, I can see the chat. So thank you for the comments in the chat. Any questions for Dr. Handley or myself?
Well, if you do have questions that may not occur to you right now, feel free to reach out to either one of us. We'll be glad to answer your questions. So
Yep.
Here's a question for
I can take this. So yeah, Claudia, this is actually my wheelhouse. I went to work in the insurance industry intentionally to really help develop and sort of grow the coverage. So the good news is that we've made a significant amount of progress in the last, especially 5 years, but even over 10 years in covering genetic testing. And so I would say for the majority of genetic tests that are out there, high quality coming from reputable labs that have validation studies to back them. So, legitimate high quality tests. Most tests are covered by most insurers. Remember that Medicare, so if you're working with patients who are older, who have Medicare, even Medicare Advantage, they usually don't cover genetic testing proactively or preventively. So those would have to be paid for out of pocket, but they will cover tests like hereditary cancer testing. And then often for the younger generation, like the babies in the NICU or even young childhood onset disorders, those are almost always covered, especially if it's kids that are sick, because the younger they are, the more likely it is to be genetic. So we're seeing a huge uptake, even in Medicaid. It has really happened over the last 3 years, especially just a huge influx of Medicaid insurance in various states are starting to cover exome and genome sequencing pretty broadly. So access to this test shouldn't be an issue for patients anymore. And even where there is maybe someone that's uninsured, a lot of the laboratories will have patient assistance programs for patients who have low income, or there will be payment plans, and they really try to make genetic testing accessible. But yeah, it's pretty widely covered now. Dan, this one's for you. What role does gene therapy have?
Yes. So this is actually very exciting. So there's a long pipeline in gene therapy, a lot of different types. The one that's recently been approved by the FDA, which is really exciting, is finally a treatment for sickle cell disease, sickle cell anemia. So sickle cell is caused, if you remember your biochemistry, it's a single nucleotide substitution, a variation that produces an amino acid that produces a malformed hemoglobin, which is responsible for the misshapen red blood cell, which is why it's called sickle cell disease. Now, the problem with that is because of that shape, that the red blood cells are not efficient at transferring oxygen and carbon dioxide. So the disease can be very debilitating. And up until now, we haven't had any successful treatments. Well, now we have ex vivo gene therapy, to be precise, where they will take a portion of the bone marrow of the patient and extract that, and then use a gene editing machinery to correct that single nucleotide variation that's responsible for the disease, and correct it. So now that it's producing normal hemoglobin. Then they take those cells, which are progenitor cells for the red blood cells, put them back into the same patient, and so there's little to no risk of rejection because it came from the same patient. And now their bone marrow is starting to produce normal red blood cells. So there are 2 FDA-approved therapies that use gene therapy for sickle cell disease right now, and there are more on the horizon, especially on many of these blood diseases that are inherited. So the future looks very bright for using gene therapies. Now, there's a lot of problems with other types. So there's ex vivo, where you take cells out of the body, then do the gene editing, then put the cells back in the body. That seems to be very successful. In vivo gene therapies have more challenges. However, there's a lot of promise in that. So it's no longer science fiction, no longer speculation. We do have effective FDA-approved gene therapies.
I want to also tack on a genetic counseling perspective about gene therapy. So, if we think about some of the integrative health modalities like Ayurvedic and acupuncture that go back, hundreds, thousands of years. Genetics and genetic medicine is really young. It's really new. So, I've been in the field for a little over 20 years. And when I first started, we really only had some basic genetic testing tools available, cytogenetics and a few single gene tests. And it has just exploded, especially in the last 10, 15 years. And so now we're at a stage where diagnosis is advanced and we can use whole genome sequencing that doesn't take 2 years and $10,000 to run. We can do it in a matter of a few months or a few weeks and at a very inexpensive cost. So we've kind of almost really nailed down the diagnostic component. Now it's going to start moving into the gene therapy, the treatment, the cure, because it used to be for genetic counselors, people would ask us, what's the point? What's the point of doing a genetic test if you can't cure my child? What's the point of doing a genetic test when there's no treatment available? And yes, there will be when they're starting to become treatments, like Dr. Handley was saying, for sickle cell and others. So it's not only super rewarding for the clinician, but it's actually starting to change and matter. And that's where that precision medicine, that individualized genomics is becoming important, because if we know the genotype, then we can triage the patient to the appropriate therapy. And in the meantime, if a gene therapy doesn't yet exist for that patient, to me as a genetic counselor, that is where integrative health modalities like Ayurvedic, chiropractic, acupuncture, whole person health, psychotherapy, all of those can play a significant role in sort of bridging that gap. So quality of life and maybe even prevention of disease can take place before a gene therapy may be available on a practical level. Another one, if epigenetics can affect multiple generations, is there the possibility that gene therapy could also have that effect? Ooh, nice question.
Yeah. So yeah, great question. The good news is no. So for gene therapies, one of the ways that it would be approved is to ensure that it doesn't affect future generations. So one of the things that science fiction often gets wrong is that that if you acquire a mutation, that somehow it's going to be passed to offspring. Well, it has to be in the germline, right? So it has to be in sperm or eggs, right, to be passed down to future generations. So gene therapies typically would be screened to not affect anything in the germline and be passed down to generations. This is a big issue in bioethics of gene therapies. So it's not something that's under the radar. It's something that is very prominent. It's a prominent issue to be addressed. So in terms of gene therapies, there's no issues of it being going into into future generations. However, if you're looking at gene therapy on the other side, where you're actually doing gene therapy on embryos, that's a whole different question. And as far as I know, South Africa has now allowed gene therapies to be used in embryos. So up until now, it hasn't been outlawed in a lot of countries. It's just been self-policing by researchers that they just don't do it. And in China, a few years ago, someone did do gene therapies on an embryo, and it seemed to be successful. However, that researcher, I think, was jailed for 3 years for doing that. So there are a lot of ethical questions that are out there. There's no uniform consensus around the world about what's allowable and what's not allowable. So in the United States, we're very sensitive to not doing any sort of gene therapy that would affect future generations, it's a great bioethics question. So, but in terms of the types of gene therapy that I had previously addressed, um, there's there's no concern about those being passed on to future generations.
I think also along this line is that so much has changed, and so much of what even 30 years ago we were told, oh, that's junk DNA, or that's, it's not possible to make that happen. Like, fetal DNA in circulating in mom's blood. I remember as a student hearing a researcher talking that she was working on this technology, and it sounded so science fiction to me, and we kept thinking there is no way that's ever going to come to fruition. And now we use NIPT testing, which is looking at fetal DNA in mom's blood all the time as standard of care in pretty much every OBGYN practice. So what you think may sound science fiction today might actually easily come to reality, in the next 10, 15, 20 years, next year. So I think the more we know, the less we know. And I stopped saying, no, that's not going to happen, because I've been surprised so many times that, what Dr. Handley's saying, it could easily be our reality in the near future.
And that's why what they called ELSI, ethical, legal, sociological um, implications. You can correct me, Stephanie, on the ELSI, but essentially bioethics is certainly something that's always part of curriculum in genomics, and certainly in genetic counseling, because
Definitely.
Genomics opens up a whole different ethical world. So, for instance, if you go and get a cholesterol test, that essentially, it's personal to you, right? If you get a genetic test, then that's actually potentially affecting your relatives. So if you get a genetic test, even direct-to-consumer genetic test, then that might expose information you're not prepared for, such as non-paternity. And if the statistics show that somewhere around 5% of people who get genetic tests for ancestry reasons, or just direct-to-consumer tests, find out that there's some sort of non-paternity or consanguineous relationship that is in their ancestry. They're unprepared for that. So you could see that could be pretty devastating psychologically, and that's where genetic counseling prior to getting a genetic test is highly recommended, to be prepared for surprises that you weren't aware of. So going back to my original point, that's one example of when you get a genetic test, it raises different ethical issues from other types of healthcare diagnostics, right? So again, if you are get a genetic test and find out you have hereditary cancer syndrome, what are your do you have ethical responsibility to inform your relatives? Maybe your relatives don't want to know. So there are a lot of ethical issues that haven't been settled. Nothing's really black and white here, and so it's a really active area of discussion, and it's all intertwined with technology. It's intertwined with the practice of genomics, and it's intertwined with genetic counseling.
Any other questions?
Yeah, I kind of answered a question that wasn't asked, but I thought it was important to to let everyone know. thank you everyone for showing up, and I hope more people get to watch this presentation. Stephanie obviously is very fantastic and very knowledgeable. He's a great resource at SCU, and I wish her, I have no doubt that her program is going to be wildly successful. And my program, the Master of Science in Human Genetics and Genomics, little plug here, we were rated the #1 master's online master's program in genetics by bestcolleges.com, #1 in the nation. So we're #1. So so we're we're really, the university's proud, and we're all proud of our teamwork and how we work together, and what we can do to help improve patient care in the future.
Definitely. Thank you, Dan. Thank you. Yes, great. Congratulations to you on your program, your amazing program. Well, we'll hang out in case anyone has any other questions, and Megan will pass it on to you. I'll stop sharing.
All right, thank you guys. I left in the chat, this recording will go on our YouTube, and probably by early next week, and we'll make sure to send that over to everybody in case anyone missed it. And I know there was a bunch of people that didn't even end up logging on, but they're going to be happy to have this recording. It was so wonderful and informative. Yeah, so thank you all. Have a great weekend.
Thank you.
All right, bye.
Thank you.
And bye.